Today I'm speaking with Lenny Harner, Residential Clinical Director for Enterhealth, a premier behavioral health provider specializing in mental health and substance abuse treatment services. Today we're discussing mindfulness, meditation, and breathing. We'll cover the various benefits of these practices and how they can affect our mental, physical, and emotional well-being. We have tips on how you can incorporate these practices into your daily lives. So, Lenny, when it comes to mindfulness, what all does that encompass and mean?
What do you want it to mean?
I don't know. Where to begin?
Well, I said that provocatively because mindfulness can mean pretty much anything that you want it to. As long as you bring your attention fully, 100%, without judgment, without a bias to whatever it is that you're doing. Whether it's listening to a bird, whether it's me talking to you at this particular moment, I'm nowhere else, I'm here 100%. So that's mindfulness. So when I said it that way, I didn't mean to be sarcastic. I mean to just be somewhat provocative in the sense that we can pigeonhole things. However, mindfulness can be whatever it is the person wants it to be. So, but let's look at it from a practical perspective, right? Mindfulness often is referred to looking at a single object and bringing your attention to it fully. By doing that, you basically abstract everything else that is going on. It's kind of like putting someone in deep sleep in the waking state, meaning that we love sleep, deep sleep. Why? Because all objects drop, not dream, but deep sleep. I mean, we pay thousands of dollars for mattresses and we don't even know we're sleeping on a mattress, right? So what if we could emulate that in the waking state? And that's what mindfulness does. It abstracts everything else out and you're focused 100% on an object, and that's peace.
So, peace, you kind of almost answered my next question, but what are some of the goals of mindfulness? What should your goal be?
Well, our mind wanders a lot, right? And some people have very overactive minds, which causes stress. A lot of times people ask me, what are you thinking? It's like, I'm not, right? I'm just being. And being is existence. Being doesn't require any thought, any feeling. It just is. And so the benefits of it is huge. Let's take telomeres. Telomeres have to do with aging, and meditation actually prevents the fraying of telomeres, which actually expands your life, and also has something to do with cognitive deficits later on in life. Think of telomeres like shoestrings.
Okay.
The tip of the shoestring is plastic. And when that plastic is gone, telomeres, then fraying starts.
Right.
And then you have all sorts of aging and cognitive deficits that could occur. So research shows that it helps in that sense. So, that's long term. But what about short term, right? If someone is struggling with cravings or urges, and they can go into a breathing technique or some sort of mindfulness and bring themselves to the present moment, then their chance of relapse is much less. So relaxation, stress, they're even doing it with individuals with virtual reality, with Oculus and the headsets in nursing homes.
Yeah.
Right?
So with all of that, how else can mindfulness, meditation, breathing techniques, how can that affect our mental health?
We know the number one reason for addiction is stress. Okay. Also, depression, obsessive compulsive disorder, anxiety, bipolar, all of the mental health diagnoses that we use. I think that meditation is a way of helping individuals center themselves, relax themselves, and maybe they don't have to go as far as into an episode, whether it's anxiety, depression, or manic. Oh, one other, pain. They're starting to use meditation to help with chronic pain.
Okay.
Yeah.
And is that a different approach to medication, or is it in tandem with?
It's in tandem, but yes, it's a very different approach. As you know, the opioid epidemic was created by just the pain scale kind of changing, and we had to start treating pain versus, I mean, they made a whole big thing about it, and that's why we have the problem we do today. I think that it's just an alternative, and a lot of the pain management clinics are using less of the opiates, less powerful substances, and implementing things like mindfulness and meditation. Because if you bring your attention to pain, then it subsides somewhat. It may not go away, but it definitely subsides, right?
Yeah. So with having maybe a mental health disorder or a mental health issue, or trying to treat chronic pain and everything that you've touched on, who should be practicing mindfulness?
Everybody. I don't think it's pigeonholed to one group. I think all of humanity could benefit from mindfulness. Maybe we wouldn't have what's going on in the world if people were more mindful about what they say, what they do, how they feel. It could even be a different world.
Yeah.
But we're mindless. We don't even know what we say half the time.
So in implementing that, in being more mindful, focusing on meditation, and things of that nature, how can we start incorporating that into our daily lives?
Good question. So if I go up to the main house, I know from my office to the gate where the pool is 67 steps. Now, why do I know that? Well, because I bring my attention to my steps. And let's say that I have something going on in A, and then all of a sudden I get called to B. And you can use this in anything you want. And I get called to B. And so I'm having to leave what I'm doing at A, and I'm thinking about it all the way up to B, and I get up there, and then I'm hit with some other things. Well, I don't have a lot of space, right? Whereas if I delete everything but 67 bits of data, then I have more of a bandwidth or space to deal with whatever is new up there versus being full when I get up there. I'm worried about what's happening down here. I've had to leave someone and they're not doing very good, and then there's something happening up there, and now I got to worry about this, and I don't know if I have enough bandwidth. When I get up there, there's nothing going on with me other than 67 bits of data. That's one way.
Yeah.
How about stop and listen to a bird? They're singing for you. They're not singing for anyone else. That's kind of like if a tree falls in a forest, does it make a sound? Well, if there's an organism that has the potential to interpret the vibrations, absolutely. So the bird, if you and I are hearing the bird, they're not. It's for me, and yours is for you. And so we can use nature in order to bring us to the present moment, which then filters out everything else the problems that you have with your kids,
Mm-hmm.
the dog that you have to put to sleep, or whatever.
And grounds and centers us in a way.
Well, it brings it down to one
Mm-hmm.
thing. It puts us in deep sleep in the waking state, which is a beautiful, I don't know if it's a metaphor or an analogy, but it is just peace that passes all understanding.
And this can be difficult for someone who's just now paying attention to this. What advice would you give someone to become more mindful?
Practice. Just like riding a bike. You get on a bike when you're little and you fall down, and you get back on the bike and you fall down, and you get back on the bike and you fall down. Pretty soon you're able to pedal the bike for a little while, and then you fall down. You went 10 yards and you fall down again. But pretty soon, all of a sudden, it's like, wow, I'm able to ride the bike. It's no different.
Yeah.
It's the same with anything. This is no different.
That's encouraging to hear. So it's not easy to get started on a road to mindfulness.
Well, the problem is that statement right there. It's not easy to get started. Means that we have to go somewhere when we're already there. See how language messes us up? As if there's somewhere to go other than where we're at.
Lenny, thank you so much for having this discussion today and taking your time to help everyone who's watching this. We appreciate it. Thank you so much.
No problem.
If you're having difficulty implementing these practices in your daily life to manage your mental health, Enterhealth can help. At our inpatient and outpatient facilities in Dallas-Fort Worth, we employ teams of experts in different areas, including physicians, psychologists, psychiatrists, dietitians, physical therapists, and more. We have the tools and the knowledge to help you get started or stay on the path to a healthy recovery from substance abuse disorder.